I would have an objection to cumulative. They're, from what I've been able to see, they're all already in evidence. I know Ms. Mull had objected to us when we appear to be putting in duplicative photos. So I don't see why at this point the defense would need to introduce these same photos again.
I sometimes do allow duplicative photos. I think I may have over-objection in this case for you. And it's just sort of, so.
Judge, it's just that if I go through, I'll take theirs out of order, and just going through and finding the ones I need. These are their pictures, and
If we are in agreement that these are, I'm going to allow it. Let's go ahead and bring the jury.
I'm going to show you what I've marked as Defense Exhibit 143 to 165, and have you look at these pictures yourself and see if you can identify them generally for us.
Yes, these are all photographs of Layla Daniel, and it's a mixture of photos that were taken on, I believe, November 17th at the emergency room, and then on November 20th at the autopsy examination.
This time I will tender 143 to 165 into the record.
Okay.
All right, we're ready for 143 to 165.
Let's start out with the contention, was the child starved in any way?
No, I do not think there's any evidence of starving or malnutrition, no.
Did you consult did you consult Dr. Darisaw's report, and were you aided in any way by that?
Well, yes, Dr. Darisaw, I believe, described her as, to make sure, well-developed and well-nourished. And I agree with that. I mean, I thought the child basically looked fine as far as nutritional status was.
Now, let's talk about the bruising on the outside of Layla's body. I'm going to show you, if I may finish, Your Honor.
You may.
I'm going to show you Defendant's Exhibit 148, if we could have the lights. What are we seeing here?
Well, the scalp has been shaven, and there is distinct.
Oh, okay. Sorry about the jury. How is he doing? Let's have the jury step out, please.
Give me a hand here. Hold on. Hold here. I've got bad back.
Are you okay?
I'm not hurting anymore. All right, so yeah, I think I should be okay. That's booby trap.
Okay. Well,
Sorry about that.
do you need a minute?
I think I'm okay.
You're okay?
Yeah.
Then let's bring the jury back.
Nothing acutely hurting.
Let's get started.
Okay.
Bring it back. Yes. Okay, we're ready to proceed.
Let's try this again. All right. This is, what number is this, ma'am?
This is number 148.
Okay. Number 148 is a photograph of Layla's head at the autopsy after the scalp has been shaven. And there is, it looks to be a contusion or a bruise here, and another one here. This is on the back of the head. You can see the child's ears. And there's a little mark there that looks to be just an incidental, a cut made during the process of shaving the scalp, which is something that occurs very frequently just in shaving the hair like this. But in and of itself, you know, the cut doesn't mean anything. It's not an injury.
Is that, can you tell us how customarily at the GBI what is the utensil that's used to shave heads?
Well, yes, a scalpel, really. It's just a regular curved scalpel, and it takes some practice, but this is how the head is typically shaved. It takes a little time, but again, with time and practice, it's easily done. But still, inadvertently, there can be just small cuts that are made on the scalp as a part of this process.
And you see a contusion on the top of the head.
Yes.
And what do you make of that?
Well, it's a bruise, and I believe that was, if I recall correctly, there was a microscopic section of that showed some evidence of inflammation. So this would mean it was somewhere perhaps in the maybe 6 to 12 hour range, possibly more than that. I mean, I looked at the section myself, so it was not 2 or 3 or 4 days old, but it was also not very, very fresh either. There were some very early healing changes. And that was one of the few bruises that really exhibited any healing of the multiple ones that were seen on her body, and which also Dr. Darasaw took sections from.
I'm going to show you what I marked as Defendant's Exhibit 158 and ask you if that gives you a better view of those scalpel marks.
Yes, it certainly does. Up here at the top, those are, again, just inadvertent cuts that are made on the scalp with the scalpel, and they don't mean anything. There is a little interrupted scrape here on the side of the head, and I think we'll talk more about this area here on the ear.
As we go along, yes. And I'm going to show you 160, Defendant's 160.
Yes. 160 is the right side of the scalp, and also I think now you can see where the contusion is, but also you can see the small cuts that were made during the course of shaving the hair. And again, they're not injuries, they're just part of incidents during the autopsy, just in the process of shaving the hair.
And that bruise is not on the top of the head, is it?
No, it's really on the back. In fact, you can see where the ears are located, so it's really on the back of the head and not on the top.
And finally, I'll show you Defendant's Exhibit 165.
Yes, 165 really is a top view looking down. You can see the right ear here as well, but the small cuts that were made along the way, just in doing the shaving, that's probably the best photograph that shows all of them. And again, those are not injuries that were caused by anyone, they're just a part of what happens, what can happen during the autopsy examination.
I'm going to show you what's been marked as Defendant's Exhibit 143.
Yes.
Can you tell us what we're seeing?
Sure. This is a photograph taken, again, at the autopsy. Now, the child died, on November 17th. The autopsy was done on November 20th, about 3 days later, which is okay. There's nothing untoward about that whatsoever. But in that time, changes can occur in the way that contusions and bruises look. There are a cluster of bruises here on the central part of the back, going a little bit to the left, and then the left lower back as well, to a lesser extent the right. But they have especially down here, it has a very uniform appearance, and it's known in forensic pathology that over the passage of time, that bruises can change in their appearance just because blood will seep to the surface. In fact, years ago, before I would say we all started doing very extensive dissections of the skin, such as Dr. Darasaw did, it was very typical to hold the body for 2, 3, even 4 days and look at it each day, because you could see changes in contusions that were not apparent before, or even bruises that you could not see initially that were, say, rising to the surface just from diffusion of the blood. But the appearance does change, and this is not the same in the way it looks as compared with the photographs that were taken of the child in the emergency room.
Let me show you, see if I can put these two together and ask you describe the difference between them.
Yes.
And this is, for the record, 149.
I think once you put these side by side, the appearance is fairly, the change in the appearance is fairly striking. You can see the general outlines of the areas of contusion, but here from the emergency room photographs, the bruises, many of them are much more discrete. There's individual contusions, individual bruises, as compared with what it looks like over here, where it looks like just one large contusion, which really it's not. It is multiple small ones that over the course of 3 days, after she passed away, just the appearance changed. In fact, the color on the skin itself changed, and this kind of dark reddish appearance is a little bit of drying as well, which is something that happens especially in small children where the skin is very, very thin. So the appearance is much different. And as far as really assessing the nature and potential causes of bruises, the photograph here on the right, which is again from the emergency room, is, I would say, more helpful because it shows more individual, well-defined bruises in specific locations as compared with the photograph on the left where blood has diffused out into the tissues and really obscured the individual characteristics. It's just not as easy to, I would say, interpret as well with the passage of time.
Can you tell us what would cause, in your opinion, in your professional opinion, to a reasonable degree of medical certainty, what caused these injuries on the child?
Well, in my opinion, these injuries were caused by Ms. Rosenbaum, who was pounding on Layla's back as Layla was choking and not breathing. Initially was flailing around and then stopped flailing. And Ms. Rosenbaum was trying to pound on the child's back to dislodge the bolus or the chunk of chicken that was stuck in her airway. And in doing so, Ms. Rosenbaum left these bruises behind. There's a scrape there. It's harder to tell, but that could readily come from a fingernail here. But you can see, again, 3 days later, it looks much bigger. It's, the characteristics of the contusions are less distinct. Here you can see individual marks that very readily could be fingers or even knuckles from, again, pounding on the child's chest, literally, without mincing words. What I appreciated was this was a repeated attempts to pound on the child's chest to remove this piece of chicken that was blocking her airway.
Was this the chest or the back?
Well, I'd say chest generically. This is her back, of course, to pounding on the back, which is known and understood. I mean, that's something that is attempts are made to get something out of the airway by pounding on the back. Typically, if the child's upside down, just so it will drop out. But anyone, all of us in the room here have choked on something somewhere along the line, and someone will come and kind of pound on your back to try to get it loose so that you stop choking and start breathing again. And that's the individual small bruises really come from, as I said, fingers, perhaps knuckles, in trying to pound on her back to get this chicken out of her throat.
And is the pounding on the back part of Heimlich Maneuver or not, or something else?
Well, it's part, the Heimlich Maneuver specifically has to do with pushing on the upper front of the abdomen, just below the rib cage, to try to create pressure inside the stomach and the esophagus, and possibly the chest, to hopefully push this piece of whatever is blocking the airway to make it pop out or come loose. But one of the initial things to do if you think someone is choking on a piece of food, and you can tell that because they stop talking and they're not making noises and start flailing around in a panic, is to pound on the back initially to see if that alone will dislodge the food, the piece of stuff that is blocking the airway. And if that doesn't work, then you move on to the compression of the front of the stomach.
Tell us, if you would, Dr. Sperry, what is the difference between the way a Heimlich maneuver should be performed on a child and the way it should be performed on an adult?
Well, the difference primarily is because has to do with the child's size. And in an adult, with one adult working on another adult, what you're supposed to do is really embrace around the chest area and put the fists right below the breastbone and push in, or pull in actually very forcefully and rapidly, again, to try to expel the food. With a child, it's different in the sense that they're much, much smaller, and you may do things like sit and have the child sitting in your lap, or perhaps kneel behind the child just in order to gain access to the lower part of the chest and the upper abdomen, to pull against the child's stomach, again, to dislodge this. But it has to do really with the difference in size between an adult and a small child, and then the positioning that can be undertaken to, again, the ultimate goal is to compress the upper abdomen and lower chest to make this food pop out.
What is the result of using adult Heimlich on a child? What is the concern about doing that? Why don't we do that?
Well, the concern is that children are much smaller. They're much more delicate. You have a lot of organs, come in a small place, small area inside of the abdomen and in the chest, and you can't use as much force. With an adult, everything is bigger. More force is necessary, really, to expel the food. But if that amount of force is transferred into a small child, the potential for injuries to be caused on the inside of the child's body is very real. Just because if you're using the same forces as you would in trying to alleviate an airway obstruction in a child, or in an adult, excuse me, if you use those same forces, you can inadvertently cause injury on the inside of a child's body just through that effort without knowing that this is happening.
Let me show you what I marked as Defendant's Exhibit 147 and tell us. You've got a light that is kind of shining on it. Tell us what we're looking at here and what it means to you, Bill.
Well, we're looking at the lower back area. There's, excuse me, some small little scrapes with a larger scrape, and then scattered contusions, bruises scattered around here. And you can make out individual detail in the bruises here. It's not just one unbroken bruise. It's a lot of little ones that are beside each other, sometimes arrayed in kind of lines or little groups, and individual small bruises. I mean, that's the nature of what the injuries are that we're seeing, is a number of small little bruises that are clustered together. And this is, when you see small bruises or see this kind of clustering, the thought again is fingers, is knuckles, is individual parts of a hand that would cause impact injuries, impact bruises to the skin, and the little scrapes It's hard to tell just from this alone. This could come from if the child is laying on something while CPR is being performed and something is scraping the back. Potentially, especially with little small abrasions like this, these could well be fingernail marks as well. Again, that's as part of pounding or striking the child's back, once again to dislodge the food that's blocking the airway.
Dr. Sperry, does it concern you any that the bruises are this low on the body? What does that mean?
What it means to me really is resuscitative maneuvers being performed by someone, a layperson who has no training at all on exactly what to do and how to do it, coupled with panic, with a situation where no matter what is being tried, the child still can't breathe, and the blockage is still there. And as this becomes chaotic, even in medical situations where there's trained individuals involved, if the desired outcome, that is getting the person resuscitated, is not happening, then sometimes, literally chaos ensues. It can be sort of controlled chaos, but everyone is trying to do the best they can to get the person resuscitated. And injuries happen just because of the level of intensity. So if you take someone who has no medical training whatsoever, who is faced with the situation of a child suddenly choking on a piece of food, then the goal is to try to get that out so the child will breathe, and nothing is working. And just by escalating and moving from one thing to the next, this, as I said, an incredibly panicked, chaotic situation is not surprising whatsoever. It's terrible.
Let me show you what I've marked as Defendant's Exhibit 146. And again, the light that's shining is kind of, but see if you can tell us what that bluish coloring on the base of the thumb is.
This right there, yes. The reason I selected that photo is just the lighting is not terribly good. The bluish coloration at the base of the thumb is not a bruise. That's normal in anyone who's deceased. The thumb muscle is very thick in this area, and there's a lot of blood, and as a consequence of this, it could look blue. In fact, I don't know, it's hard to tell even from across the room. You can see, my thumb is kind of blue there. It's just how God built us. It's how the muscles are structured and the thick muscle in that area. And it's, it should never be mistaken for a bruise of some sort, because it's just a natural part of the body, and it's more enhanced after someone passes away.
Let me show you what I marked as 159 and see if that gives a better view of that.
Yeah, it does. It does. You can see this area, this blue discoloration here, this kind of ill-defined. But that's a normal postmortem finding. As I said, it's normal in someone who is not dead. So I can show you my hands. You can see the bluish discoloration, but it should never be mistaken for an actual bruise.
I want to ask you, Dr. Sperry, looking at Defendant's Exhibit 161, what could have caused these bruises on the legs of Layla?
Okay. Now, this also is useful. We talked about this a bit. I'm not going to belabor it, but this is a photograph of the autopsy examination. And now that you've seen the individual bruises that were very readily apparent from the hospital, you can see how the appearance has changed over the passage of, from the 17th to the 20th of November. And this is, again, just what happens after someone has died. This is an artifact, we call it. It's something that is, the changes are created just by the fact that the child is deceased and the blood spreads out a little bit more. Now, with that, looking at these bruises, individual bruises down here on the thighs, part of what Mrs. Rosenbaum describes in the way that she was trying to hold the child in order to do the Heimlich Maneuver as best as she understood. There were times where she was holding the child's legs or had the child's arms, I think, as I can recall, sort of under her arms and holding.
I would object.
Excuse me.
I would object to this point that this is hearsay.
Response?
Your Honor, I will tailor it. Given what you saw on the video of Jennifer's statement, what can you tell us about what those markings are on the child's legs?
Okay, yeah, and I'll abbreviate it. I mean, I think these markings are related to the positions that Ms. Rosenbaum had, where she had her hands at different places and different parts of Layla's body during the complex maneuvers that she was undertaking, again, to try to dislodge the blockage in the child's throat. She was trying one thing, and the next, and as I said, it was very disorganized and chaotic, but the child was dying in front of her.
At some point in time, let me withdraw that. Let me show you what I've marked as Defendants 145. Tell us what we are seeing right here.
Sure. This is a photograph of the front of the abdomen of Layla's body, and then there are some areas of bruising, some with some little tiny scrapes along the, just kind of above the hip bone area on the right and left side, just on the lower abdomen sides.
What does that come from?
That comes from gripping, that is holding the child's abdomen with Ms. Rosenbaum behind the child and reaching around to hold the abdomen, again, as part of the maneuvers that she was attempting to try to dislodge the blockage from the child's throat. And in fact, there are better pictures, but there's somewhat of a linear character with some little scrapes that probably appear to come from fingers and some little scrapes from just fingernails, holding on to the child, again, trying one thing after another to alleviate, to remove this blockage, and not having success, and again, the panic and the chaos just intensified.
Let me show you 156, Defendants 156, and see if that gives you a better view of what you're talking about.
Well, it really does. This is the left abdomen, the pelvis is kind of right around in here, and you can see from the previous photo where the heart monitor pad was. And here's these two linear bruises with some little tiny punctate scrapes or pinpoint scrapes, and this looks like finger marks with maybe some fingernails. As I recall, that actually was described by the first responders, these particular injuries, as looking like finger marks on the child's sides of the abdomen.
Defendants 162. What are we looking at here?
Well, we're looking at, a similar view to what we saw before, the markings on the right, her left and her right side of the abdomen, just above the pelvis on the sides. And again, I think this goes along with what Ms. Rosenbaum was trying to do, holding the child, again, while trying everything that she thought she could do in order to compress the abdomen, to stabilize the child while she's trying to get the blockage out of the child's throat.
Stop here for a minute and talk about bruising, Dr. Sperry. And you have can you tell us a little bit about bruising? Can you tell bruising date by color?
Okay. Well, it is not possible, and that's a big word in forensic pathology, it is not possible to accurately tell the age of a bruise by looking at its color alone. And we will experience people, including myself, will be wrong far more than we're right as far as looking at a bruise or a contusion and trying to determine how old it is. There are a couple of things that seem to be fairly standard. Somewhere around maybe the 12th to 14th day, maybe there's oftentimes a yellowish halo around a healing bruise. That seems to be a fairly reliable marker of sort of time frames. But unfortunately, with the naked eye, you cannot look at bruises. I mean, the best people that I know of cannot look at a bruise and tell you how old it is, or really tell which ones are necessarily older or younger than others. There's so many factors involved. The skin color of an individual, whether child or adult, whether they're very light-skinned or African-American or somewhere in between. And a bruise really is bleeding in the skin and the tissues beneath the skin. So the amount of bleeding is incredibly variable. I mean, not every bruise is the same as every other bruise. There's so many factors involved that you just can't really tell. And certainly you cannot reliably tell by looking with the naked eye.
What must you do in order to age an injury that has bruised up?
In someone who's living, it's very, very difficult. Sometimes photographing bruises over the course of days just to see how they mature and at what point maybe the yellow coloration starts to show. Again, gives an idea, but you can see that it's very vague. And it's not uniform, I guess is the way to put it. It's not scientifically reliable. Now, something that we as forensic pathologists have the ability to do with someone who is deceased is we'll take little tiny pieces of bruises and look at them under the microscope. And by doing that, we'll see the degree of healing, the body's response to bruises, and how long perhaps this healing has been going on. But again, with the understanding that still is very, very imprecise. It is not precise at all. For instance, a fresh bruise, or say a bruise that under the microscope has evidence of some bleeding, but no other healing changes, I can't tell you whether that bruise is 5 minutes old or 5 hours old. It usually takes at least about 6 hours or so of life, of survival, for the healing changes to begin to be seen in a bruise under the microscope. And then things progress, but still being able to narrow it down to a specific day or a specific hour is really just impossible. So that's microscopically, we can do better than with the naked eye, but there's still some fairly severe limitations.
And with regards to microscopic examinations, were you able to determine anything about the age of any of these injuries?
Yes.
What did you determine about the body?
Well, the vast majority of the bruises that were on the Layla's body surface that Dr. Darasaw sampled were recent in the sense that there was bleeding, but no evidence of any, we call it a cellular reaction, no inflammation. In other words, no evidence that the bruise had been there long enough for the body to respond and start the healing process. So these could be anywhere from minutes to maybe 5, 6 hours potentially, anywhere in there. There were very few bruises that had some early healing changes with some inflammation that was going on that would, from what I saw looking at the tissue slides, put them up in the maybe 6 to 12 hour range, possibly longer. Again, you can understand it, this still is not precise. And since everyone is different, we can identify different stages, but as far as definitively saying that a bruise is 11 hours and 13 minutes old is just impossible to do.
Looking at Defendant's Exhibit 157, what are we looking at here?
Oh, that is, I think, well, that's the lower, yes, the lower right abdomen. I think, yes, there's an abrasion here. This is just above the pelvis. And then here's some bruises that they look at all sort of different colors. But again, I think you can see now that the color alone just is not enough to really be able to make a distinction. And they generally look like finger marks to me.
see this white band below the belly button.
Yes.
What is that?
Well, frankly, it looks like just a pressure mark to me that, in other words, there's something that was putting pressure against the child's abdomen at some point after or around death or even after death. So the blood is not within the central area, but is around the periphery. Now, I know it's been described, I've looked at all the photographs, I've looked at them repeatedly. There's descriptions that this seems to be a scar. It doesn't look like a scar to me, and I've seen an awful lot of scars. And at the same time, another thing to do, if there was a question at all, the thing to do would be to take a small piece of that and look at it under the microscope. Because if it truly is a scar, there are going to be changes, old healing changes in the skin and the tissues underneath the skin that would be very, very obvious. But that was not done. It's just the visual appearance. So I think the conclusion is very limited because it's only based upon what it seems to appear to be visually.
And do you see that mark again on 162? Is that a better view of that mark?
Yes, it's right in through here. It's very uniform. It's very well defined. I think there's a little area of interruption, as I recall, along here. So that's the best I can tell you, except that just to say that there's no, other than the color change, I don't see any line of demarcation. I mean, any difference, I should say, in the skin appearance from one part to the next. Scars, usually raised in some way, they're oftentimes very irregular on the inside, but there's a tangible difference to the skin and its texture with the scar, and it's in an unusual place. And I see that the fact that it's so uniform really doesn't disturb me at all as far as being some sort of remote injury of some nature.
I want to talk to you about the ears.
Yes.
I'm going to show you what I've marked as 154 and 155. And see if you can tell us what we are looking at and why it's significant.
Yes. This is, I keep looking down here, I'm not going to do that again. This is the left ear. And you can see these little lesions here that are red, but they're irregular and have some crustiness to them. It looks like the hair has been pulled away. Here, the hair is actually stuck to parts of these lesions and interrupted. This is what impetigo looks like. Impetigo is a superficial skin infection caused by the staph bacteria. It's very common in children, and it can be spread from one child to the next, and they can spread it on their own body. But the crustiness with the hair sort of stuck in here, that's very typical for what impetigo looks like, especially in a child like this who has longer hair and who scratches the area, and the hair, it weeps and the hair gets stuck to it. So that's pretty typical for impetigo. That's not an injury of some sort.
Let me show you what I've marked as 151, and do we see any more impetigo here?
Yes. One of the hallmarks of impetigo, as I mentioned, is that children will scratch these areas and then they'll pick their nose or put their hands on their face and spread the bacteria of other places. And these little lesions right here on the nose, that's where children will spread the impetigo to. They pick their nose, they spread the infection there, and then you see these little red marks as a consequence. And I don't know of another, once I saw the impetigo on the ear, then the things on the nose to me became much more, I could see the explanation for those, because otherwise I don't know what else would do that. But the impetigo is a definite real thing.
Sure you. Just,
Resolve the distortion issue. Okay. Are you still doing all right?
Yeah, I'm fine.
Let's see what this is. This must be.
Yeah, this is-
from here. Do we know if this is related to
I'm
the
sorry.
media? Is it the possibility that we have these two microphones so close together?
You want to turn it off?
You're getting a feedback
Let's
loop,
see if
maybe?
that's the issue. If it's something else, we'll have to deal with it. I don't know. Something that can be done with this soundboard over here.
Maybe where it's coming from.
No problem.
This comes
From the what?
from the internal.
Internal?
Yes, sir. From the speaker system.
Soundboard.
Yeah.
You may get them to call Ted. Yeah. We're gonna go ahead and take a short break. We'll have the tech people come up here and see if it's the soundboard that's causing the problem. And let's take, let's see, why don't we just give everybody an early lunch and come back at 1 o'clock? That way we can take our time and work through this, hopefully have a system that's working at 1 o'clock.